welcome and thank you to everyone who's watching from home as well. I wish you could all be here, and I hope you feel part of this, because you are all very much part of this as well. So my name's Mary Biles. I'm going to let the panelists introduce themselves as well. But it's just going to be on clinicians' perspectives. So it's interesting. We had a little bit of that in the last panel. So before we start, just a quick thank you to MedCan Support and Drug Science and the venue and everyone that's been volunteering to make this happen. And I'm just going to mention the people who are watching live stream, and we've got some questions that are going out to them as well, which I'm just going to go through. So the question that they're going to be asked is, how knowledgeable do you feel your prescribing clinicians are about cannabis? And so they have the options of choosing from, I feel confident in their level of knowledge. The other option is, I sometimes feel I know more than them, but they are open to learning from my expertise. And finally, I worry they do not know enough about medical cannabis. Okay, so those are the three options that they have to choose from. It will be interesting to hear what the results are. So we've got a great panel of clinicians gathered here today to talk about their experiences of being involved in the process of prescribing cannabis, plus a patient as well, and a drug policy expert. So I'm going to get each panelist to introduce themselves so they know far more about their expertise than I do. So let's start here with Dr. Niraj Singh.
Do I take one of these?
Oh, yes. Grab a mic, everyone.
Good morning, everybody. Hi. Real pleasure to be here. Real thank you and kudos to MedCan Support and Drug Science for holding this absolutely fantastic event. Maybe the first one in terms of patient focus. Is that right?
It is, yes.
Absolutely incredible. I'm Dr. Niraj Singh. I'm a consultant psychiatrist, been one for 13 years, thereabouts, and I've been prescribing medical cannabis for around 3 years now. I'm also an executive committee member of the UK MCCS. And so, yeah, a great pleasure to be here. I look forward to sharing my experiences and also learning from everyone as well.
I think that's really interesting that it's this is a two-way dialogue. So on that note, I hope you're all thinking of your questions as well to answer at the end. Okay, Katya.
Hi, everyone. Really pleasure to be on this panel today. My name is Katya Kowalski, and I'm the head of operations at Volteface. We're a drug policy think tank and advocacy organization. I've been involved in the cannabis sector for the last 2 years, and I've got a background in psychology. So I studied psychology at university and quite quickly became fascinated between the relationships between kind of drug use and mental health. And that kind of led me down a path to becoming really interested in the potential benefits of currently controlled drugs in treating mental health conditions and other health conditions.
Great.
Hi, I'm Kevin. I'm the patient on the panel today. I've been a cannabis user for 40 years this month, actually. Obviously started off recreationally, and then that kind of went into just having a joint before bed to help me sleep. So even back then, before I realised there was such a thing as medical cannabis, I was using it medicinally without really realising. A few years ago, my wife bought me a book about the darknet, because I'm a complete geek and I love stuff like that. And I looked on the darknet markets, and my first question was, why are there so many strains? Where did all these appear from? And I looked it up, and that introduced me to the whole world of kind of terpenes and the endocannabinoid system, and it was just like this light bulb moment. And I realised that you could actually get cannabis for particular conditions and symptoms, and that's when I kind of started to really seriously look into using it as something in my everyday health routine. And I've been doing it ever since. I've been legal for 2 years now, and I'm also quite involved with PLEA. I'm on the patient working group as well, and that's all led me here today, and thank you, Mary, for inviting me.
My pleasure. Dani.
Hi, I'm Dr. Dani Gordon. I'm a medical doctor, and I specialize in integrative in cannabis medicine. I started out 13 years ago, actually, just like you, Nij. So it's been around the same amount of time as you, as a doctor. And I've prescribed patients first in Canada and now in the UK at our clinic here. I prescribe for thousands of medical cannabis patients. My other training is I'm a family medicine doctor, or in the UK as a GP. So I prescribe across all of the specialty ranges. I have quite deep expertise because I've been doing this for quite a few number of years now. Although I still learn every day from my patients something new. And I'm just here to hopefully share my experience and then learn from everyone here as well. Thank you.
I'm Sophie Hayes. I'm a qualified nurse. I am trained, I've previously worked in accident emergency and intensive care. I've been working in cannabis for around 8 years. I started in advocacy and then and supported the patients with the United Patients Alliance. And then on the law change, I sort of went back to just my registered nursing and intensive care. I left in 2020 full-time for reasons that I'm sure no one needs the ins and outs of. Then I got offered a job because of my combined experience with registered as a nurse and as a patient advocate at a clinic called Integro Clinics, and I worked as the lead clinic nurse there until I held an event at the Royal Society of Medicine training consultants in cannabis medicine, and following on from that, I got offered the job of clinical trial manager for the campaign trial, so the chronic pain and cannabis flower trial that's currently ongoing at the moment. Sorry, it doesn't matter how often I do this, like, this still happens, so excuse me.
Thank you. I think it's really helpful to see that we all get nervous. Like we're all humans. We're all humans, and I think that's something. Hopefully today, I think with clinicians there can be this sort of othering of the patient, othering of the clinician. So I really want to start off by hearing the clinician stories, your journey to cannabis. How did this all happen for you, Nij?
So, it was born out of frustration. Frustration because I wasn't really seeing the outcomes that I wanted for my patients. And I have an Indian background. I'm Hindu. I studied the Vedas. In the Vedas, I was reading that cannabis was quite prominent, and the yogi Patanjali actually mentions cannabis amongst other sorts of other medicines as well. And I did my research online. I've always been interested in plant medicine, herbs, spices, and how they can also help. You as well, I know, cacao, various other things. And on doing that research, I found Professor Mike Barnes's training, went down, did that. It was a real eye-opener. We were then supported, really, onto how to prescribe. And with trepidation, actually the fear of God running through me, I did my first prescription. I was actually on the verge of not doing it, simply because I'd been so conditioned to the fact or hearing that cannabis is bad. It causes schizophrenia. It causes lots of detrimental effects. It destroys lives. And this is what I've been pervasively hearing since, through school, through university, medical education, even beyond that in postgraduate curricula. So I then just got over that barrier. It was great to have a great peer support through other colleagues, and haven't looked back since, really. Just been able to make a real difference to people's lives and get them off other, help them reduce other licensed medicines at the same time. So it's been a real mutual learning experience, actually, as well. I think that's one of the best things about it. Medicine is traditionally a paradigm of maternalism, paternalism, the way we kind of conduct it. But this is much more about synergy. This is about mutual learning. I learn so much because patients that I see are experts by experience. They know more than me quite a lot of the time. So they're telling me what helps them, what particular terpenes might benefit them as well. And I'm looking forward to the future when we might be having much more emphasis on that in certificate analyses and products. That's what we really need to see. So it's been an absolutely humbling educational experience, and it's really been great to see the positive benefits that patients have and the learning that I've managed to accrue over that time. It's now time really to get this out more to everywhere, really, to schools, to universities, to the medical sorority, fraternity, everywhere. We need, education is the key.
Absolutely, and I love that you use the word humility, because that seems to be really, really key in all this, because I don't know, a lot of people's experiences generally with the medical profession is that doctors always know best, and they're not open to patient experts. So thank you. It gladdens my heart, because I think it's the only way forward, you know, that there is this synergy and symbiosis. So great. Dr. Dani.
Thank you. So how did I start out with cannabis? So I started out as a bright-eyed young doctor in 2009, and I put up my shingle, and I was already really interested in integrative medicine, and I went on to get board qualified in integrative medicine, which is an American board qualified specialty of medicine in the US, believe it or not. And I went back after that training, and I was using all these wonderful things with my patients. I was prescribing them drugs alongside botanicals and teaching them how to meditate and breathe. But I still wasn't using cannabis. And all of my patients who were coming to me, and this was in Canada, they were saying, Dr. Gordon, we're coming to you because you're integrative, but look, I'm also using cannabis. Why can't you prescribe me that? And because of the same prejudices as I had growing up that Niraj has already alluded to, I still wasn't using cannabis in my own practice. And that all changed over time because of my patients. So the first experience I had with medicinal cannabis was one of the small practices I had in BC. There was a guy in the community that my patients were going to get their medicine. And he was a self-trained herbalist. He was not a doctor, but he did these oils for my patients with cancer, with terrible chronic pain. And so one day I invited him, and he was, you know, a member of the community, and I invited him to the practice, just kind of, you know, talk to him. And, you know, he came into the practice. I remember, you know, having a big whiff of cannabis, and he basically was telling me about these oils that he made. And of course, they were kind of gray zone legal, because at the time cannabis was decriminalized. This is before 2018, when, you know, adult use is legal now in Canada, but they weren't necessarily technically legal. So I couldn't recommend my patients to him. But at least I knew where my patients were getting a lot of their medicine, and I could, in a harm reduction capacity, start to speak to them about their medicine. And that's really how I started to learn. And then in 2015, I wrote my first prescription for cannabis. And this was after I became a patient myself. I had a terrible injury to my hand. I had 2 semi-successful surgeries. I developed a funny hair growth pattern, and they said, oh, you're going to have this thing called complex regional pain syndrome. Why don't you take some gabapentin for the rest of your life? And I said, oh, that doesn't sound very good. So I was using all my other integrative tools, but I was at my integrative medicine conference, and a very forward-thinking psychiatrist was there, and he said, well, have you tried cannabis? And I said, well, no, I'm kind of afraid to. So anyways, I did, and it massively helped my neuropathic pain. I was using it topically, actually, which is something we don't have access to here in the UK for patients, which I really think we should. Whole nother story. Went back to Canada, started prescribing for my patients. It was different in Canada than it is here. It was much easier. It was not a controlled drug. I did not have to write it on a triplicate pad that is very controlled. I basically gave them what's called an authorization. So I was learning so much about cannabis with my patients, because an authorization basically means that I could give them the number of grams per day that they were allowed to have, and then they went to this dispensary and got what they think they wanted. Obviously, I was guiding this, and you know, some doctors did guide, and some doctors didn't. Because of my integrative background and my botanical medicine background, I was able to guide them, but it was certainly a partnership. I did home grow own prescriptions in Canada as well for my patients who had the physical ability to grow their medicine that they could not afford some of the ready-made products on the market. It was a smaller part of the practice that I had, but it was, for some patients, it worked very well. And just the wealth of experience that I learned from them. Then when I moved back to the UK in 2018, I got involved with Professor Mike Barnes, and you know, he founded the society, and I was one of the founding members of the Medical Cannabis Clinicians Society, and training doctors, and really got into the training and education and mentoring side of this. And now I see patients in my UK practice, which is an integrative medicine practice. I don't just throw cannabis at people because I really don't think that's the best way to treat patients as a whole person. But we use cannabis, we use drugs when we need to, we use botanical medicines, we use mind-body practices, all integration therapies, everything. And this is where I think cannabis fits best, because cannabis is a quality of life medication. We're not saying it's going to cure everyone's condition instantly. That's not what I'm doing. I'm giving people their life back, and that's why I do this kind of medicine, because I have had patients who have completely changed their life after going on medical cannabis. And I had patients who couldn't work for years, and they can now do something they love. I had patients who their family life was falling apart because they were in so much pain and they had so much dysfunction from all the opioids and all the medications that weren't really working. And we switched them to medical cannabis, and they have their family life back. They can play with their children again. They can have a relationship with their partner. They can have sex again. I mean, these are the things no one talks about, but they're so important. And this is really why I do what I do. And I want to really share it with as many people as I can, the value in this medicine. Thank you.
I love that, what you're saying about cannabis being a gateway to better quality of life, because so much it's a narrative of cannabis being the gateway to, well, where does it end up? Heroin, crack, or whatever, So time and time again, it's so clear. It's an opening of a door to just having your life back. It's incredible. Sophie, how about you? What's been your story?
So a little bit more in depth into the sort of step-by-step that I just ran through.
Yes.
No, it's fine. My partner got diagnosed with Crohn's disease in 2010. So at that point, found that cannabis was very helpful for managing appetite stimulation, sleep, mood, and pain predominantly. And because of the kind of people we are, and I was training at the time, so I was like, we need to figure out why that is, and not just accept at face value that it does what it does. And I think through that research, we found people like Clark and Kieran, and found people who also with multiple different conditions use cannabis for their symptom management. And I think it was just fascinating that it worked for so many conditions that are have so many different kinds of symptoms. So for that reason, just started to become fascinated with it. I think as a clinician as well, through supporting patients in advocacy, one of the things that struck me was that there was a lot of patients who were, as you described them, expert patients, who were very knowledgeable about their condition, knowledgeable about the cannabis that they were using to manage the symptoms, like what times of day, dosage, strains, all these kind of things. But because of the negative interactions they had with their clinicians, that, which ranged from everything from, if it's working for you, just keep going and we'll see how it goes, and they worked together with them, but it went all the way to the point where they were going to report them to the police or refuse to care for them anymore. And therefore, these individuals remove themselves from the medical system altogether, and these are people with complex conditions, right? I'm saying that like you're not all here, I'm really sorry. So you move to a community that will take care of you. And that's what we were seeing. We were seeing a lot of patients who, with complex conditions, a lot of them were conditions that deteriorate over time, and they were reaching out to a community who was taking care of them. What I was sort of hoping, and the campaign for the law change, when the law change happened, I went back to intensive care and refocused on my nursing, because people could get prescriptions, and that was an incredible moment when that happened. From having worked, all the patients who worked so hard to get there and the patient families, that was a huge moment. And I think a lot of us probably thought that was it. And I think that what we have seen is that prescriptions have, exactly as people have said, prevented them from being arrested. And that alone, when I've talked to patients that I've worked with at the clinic, talk about that anxiety of being legal being lifted, and how much of an impact that has, and how much of your time and your life and your brain space is taken up by trying to source it, trying to make sure you have the right thing. If you are trying to predict your dealer going out of stock, you're trying to buy up more of the thing that you found or the strain that you found that worked really well for you, you wait for it to come back. So, like, what happened was when I got the job at Integro clinics, I found myself having a lot of conversations with those individuals, with expert patients, where you guys knew what you wanted and what was working for you, but also the cost was very high, particularly right at the beginning. And I think that what we did a lot of at Integro particularly was try and provide really good clinical care, because that was the one thing, you know, these patients had not been in touch with medical systems, sometimes 10, sometimes 20 years. And to give someone confidence that we will listen to you and that we take you seriously and that we want to support you to do what you do now, like, that was really important. And building that trust and relationship where it's a give and take between both yourselves and us as clinicians, where, you know, a lot of the time when we talked about cost, for example, I would work with, like Dr. Aurora said, I think earlier, patients who've been using flour for a long, long period of time, you know, they assumed that, you know, when we talked about it, saying I'm using flour every 2 or 3 hours, and it costing me huge amounts of money. I got to get between 60 and 90 grams of flour every month, and it's just not sustainable. So we would have conversations, you know, okay, so that's what works for you prior to the law change. There are these oils, yes, currently they're isolates. I know there are full extract oils now. You know, this is a long-acting medication. If you're administering medication every 2 hours, you probably need a long-acting medication 6 to 8 hours. That's what the sublingual oils are. So why don't we try that, work with me on this, and actually that will reduce your cost by about 200, 300 pounds. And we did that with a lot of patients. And so there was this huge learning curve for myself and patients who had this knowledge, where they actually did. Patients who've been using flour for like 10 years transferred onto an oil with one flour, with a small amount of flour for things like panic attacks, or what I think people don't necessarily like the term breakthrough pain, but high pain situations. And they said exactly what I've just said, which is, yes, it was working. This combination prescription was working. It was often the prescription that we did most often was a combination of long-acting and short-acting. And they said, you know, I'm not thinking about it all the time. Like you said, you know, there's amazing things happen in your life. You had patients go back to like deep sea diving who had back pain. I was like, that's phenomenal, right? And so going back to doing GCSEs and all this sort of thing. And like, it's a relationship. It's a relationship between you and your doctor, and it's trusting each other that no one knows everything. That's one of the things that I don't know if you guys agree. When I was training as a nurse, one of the things that I was told was, no one knows everything. It's always a collaborative effort. And you know, guys, from being in NHS care, how many individuals it takes with specialist knowledge that we have in our particular areas to take care of you properly. And integrative medicine is trying to put that all in one place, right? So, like, it's a collaborative effort and it's a relationship. And we're listening, if that helps.
Thank you so much, Sophie, because I know I sort of was hearing in the previous session that patients don't always feel that they are getting that care from their clinics. So I'm hoping that's, you know, a work in progress, and possibly that's also the role of the nurse, so which we're going to touch on later. I'm really interested, Nij, to talk about psychiatry, because, you know, it's kind of, in psychiatrists, seem to be the most vociferous about linking cannabis and psychosis. So, yeah, what's your professional opinion? Sorry.
Do you want? Can I use expletives? No. This is what we're taught about. This comes back to the kind of conditioned message that we get put into during medical school, during universities, and other programs as well. Now, I was just yesterday at another conference, and there was this Greek word which was for, I think, drug or something, pharmakon, and it was actually results, it means that something can act as a medicine but can also act as a toxin, right? And so we must acknowledge the fact that whilst we have the best of intentions, all medicines can potentially have side effects. But I have a real problem with this kind of idea that cannabis equals psychosis, which is often what is the narrative, yeah? We have a plant with hundreds and hundreds and hundreds of constituents, and it's so reductionist to actually attribute any one particular compound or constituent of that plant to, for example, psychotic sequelae or anything like that. So I really, really think it's important to really counter that. That said, we also need to acknowledge the fact that people do experience really detrimental effects in their life from high-grade skunk, which can be quite detrimental, can cause downregulation of CB1 receptors in the brain, and and the results equally. But to unilaterally sort of define that cannabis on its own can cause psychosis is absolute the wrong message, completely wrong.
I mean, sort of segueing from that into the territory of THC, it's not to say that within your broad range of patients, THC can be incredibly useful, can't it? So perhaps you can just sort of talk about a little bit the range of conditions that you're treating, and where you see particular success, what kind of cannabinoid ratios or terpenes even that you've seen in your patients have been helpful.
Yeah. So I see a lot of patients who struggle with anxiety, even patients with depression, mental health problems associated with autism, ADHD, obsessive compulsive disorder. And more recently, I've seen patients struggling with dementia as well. So conditions which are linked with the neurodevelopmental period, like ADHD and mental health problems associated with autism, do require THC as well. Tourette syndrome is an example as well, one of those conditions, OCD. Why? Because CB1 receptors are prevalent within the brain. That's where THC acts on as well. So people can gain a lot of relief from THC as well. Important to bear in mind that CBD is often added as well because it has its own benefits in terms of mitigating anxiety, but also counteracting any potential negative effects of THC as well. But let's not forget, we often speak of it as THC and CBD. But like I said, hundreds and hundreds of components of the plant, the whole plant. We all know the whole plant is the most effective. Terpenes can be really beneficial. Limonene for lifting mood. Myrcene for helping sleep. Linalool for helping sleep at nighttime. And that's another area as well, sleep disorders. Nobody ever comes presenting with one unilateral symptom. That's the important thing as well. So often I'll see people with primary conditions relating to mental health, but they may have fibromyalgia, might have chronic pain as well alongside that, but they may have sleep disorders. Anxiety and depression often go hand in hand as well. So, it's important to obviously understand what the specific terpene profiles are, educate people. But as I said, I learn from others because patients are experts by experience. They can tell me, for somebody who may be having autism, might have particular sensory processing difficulties. There might be a particular terpene profiles that might be beneficial to them in terms of their sensory processing needs. That's where it's really important to ensure, as Sophie aptly said, is a collaborative approach.
Wonderful. How have your psychiatrist colleagues reacted to this new avenue of work that you've taken up in the last few years?
There's been a range. My Royal College, actually, the Royal College of Psychiatrists, had put out a position statement a few years ago, which was quite sort of sitting on the fence, like kind of not wavering either way. And that's actually quite different from a lot of other Royal Colleges. And we're steadily growing into a sort of area of inquisitiveness, I feel, And I think that more recently led to myself and a few colleagues here today doing a webinar for the Royal College of Psychiatrists. I think it's the first one for medicinal cannabis, just about 2 or 3 weeks ago. And I think that was really important. We had about 60 odd doctors register for that. And I think that's really important, is starting to get the message out further, educate people. It needs to start earlier. It does really need to start earlier. So certainly colleagues are starting to open up with that kind of inquisitiveness, asking questions, wanting to learn more. The UK MCCS is a fantastic forum, very welcoming to help with that peer support. I'm getting, and I'm offering colleagues, psychiatry colleagues as well, a forum to help, to do sort of Q&As, just ask the questions. A lot of people do have that curiosity. It's then really getting them over that fence. Sunil, Dr. Aurora aptly mentioned that analogy of the wildebeest crossing the Serengeti, get eaten by crocodiles, or waiting to see whether they're going to get eaten by crocodiles, or are we going to get to the other side, really? But my message to psychiatry colleagues and all medical colleagues is that this is a safe medicine, this is effective medicine, it works, have courage, just keep an open mind and you'll be supported.
We really need pioneers like yourself for this work, we really do, and I'm so grateful that you're here and you're doing this work because, as we all know, as well as chronic pain, mental health is one of the key areas where people are receiving medical cannabis medications or through the legacy market. So we need more psychiatrists on board. Kevin, so you are a patient. You've gone from the legacy market through to the legal access for your own mental health issues. How's that been? How's that been, that kind of move from legacy to the clinic? How's it going for you?
Well, I think it's already, been touched on earlier about the difference in kind of quality and choices and things like that. But from my own point of view, I definitely think I made the right decision in becoming a legal patient, because there is still this thing. I mean, for a long time, I've been going to my GP about anxiety and depression and things like that, and never once mentioned that I was using cannabis at all, apart from I think about 3 or 4 years ago when I was really at a very low point and my anxiety was just crushing me. And I felt I had to mention it just in case it was part of the problem. I mean, as far as I was concerned, I was using the cannabis to sort of manage it, but, even when you're managing things, you still have peaks and troughs. It's not like taking tranquilizers or something like that where you just plateau and you go on. That's the whole point of it, really, is that you can carry on with your everyday life, but the sort of flip side of that is you have good days and you have bad days. So I've had issues with psychiatrists in the past. My first experience of a psychiatrist was in my late 20s, and I sat and talked to him for an hour, really, poured my heart out. And at the end of the hour, his conclusion was that I was an endorphin addict that liked the sight of my own blood, which I could have told him that anyway. That didn't end well. I had CBT, cognitive behaviour therapy, more recently. That was an online thing, and I actually, what my son would call rage quit, when it came to a part where I was supposed to imagine my problems, write them down on a piece of paper and drop them into a stream and let them float away. So, neither of these things have been kind of positive experiences. So when I actually came to be legal and I had my assessment and I sort of, spoke to the psychiatrist for the first time, I'd been medicating or using cannabis medicinally for a while now. And I was in a pretty good place, actually, at the time. So it was a different conversation that we had. It was more about how I was managing my symptoms, what was different from before, and it was, I felt more like I was being monitored rather than them trying to actually cure me or anything like that. There was almost like an understanding that we found a solution. Let's just see how you get on with it. And this has been my experience from all my kind of checkups ever since. It's always been, how are you finding it? Have you had any adverse side effects? Especially when you kind of change from one strain to another. I mean, we all know it takes a while to find something that works really, really well for you. You'll try a strain and it will be okay for the anxiety, but not really good for the pain or something like that. So you kind of work through these things. But it's been great. It's been really good to finally be able to talk about it after all these years. To actually have a conversation with a professional and to understand that I can take cannabis along with the NHS medications I'm taking. That's was quite a weight on my mind, that maybe taking the cannabis was maybe interfering with the other medications that I need to take for, other problems that I have. So to finally kind of get, I'm going to say, approval of doing this thing that I'd been doing illegally for so long, and actually knowing it was the right thing to do, it's been great. Really, really good.
That's fantastic. I mean, have you, we've talked about collaboration, that kind of two-way relationship. Is that something that you've experienced? Have you had the aftercare that Sophie was talking about?
I said I do feel like it is monitoring. It doesn't feel intrusive, and it almost doesn't feel like talking to a psychiatrist. I mean, we talk about stigma with using cannabis, but I mean, what about the stigma of having to go to a psychiatrist in the first place? And there's none of that. I have these genuinely nice chats that I actually quite look forward to with people. I'm actually with Sapphire at the moment, and I don't always see the same person, but I don't feel that's a problem. It's the same as going to the doctor. You don't always see the same doctor, but they have access to your medical notes, so it's fine. I feel well managed, definitely.
That's great to hear. Dani, obviously you've kind of straddled both sides of the Atlantic. I'm interested to know, in terms of products, I have a sense that there are certain frustrations about what you've got access to here in the UK. Can you share what your thoughts on that? What perhaps what you had access to in Canada, and yeah.
Yeah. So is this on? Thank you, Kevin. So first of all, I think what Kevin said is really interesting. I just wanted to say that I'm so happy you feel well managed, because I just want to say to everyone out there is good care going on, and you just have to find the right person for you, really. So my approach, of course, is an integrative medicine approach. So I see people for longer appointments. We look at the whole picture, not just cannabis, but part of that is obviously, what products are going to be best for them. And in Canada, I was just so spoiled, and I didn't really realize how spoiled I was until I came and started prescribing here in the UK. So it's a double-edged sword, because of course, because I'm very comfortable with botanical medicine, more choice for me is great. It's like candy shop, and for my patients. But for sometimes practitioners who might be new to medical cannabis, actually having too much choice might be quite overwhelming for them. So I understand the challenges that they might face. But certainly in Canada, we could just get unlimited strains, really, of different flowers, especially flower. Oils, there wasn't as many, but coming to the UK, because I'm a fully independent clinic, one of the only ones in the UK, I prescribe whatever on the market is best for my patient. So I don't care what company makes it. I care what the product is. Ideally, I can get the terpene profile and the COA and see exactly what's in it. And a lot of my patients have already been seen in other clinics, and they've received some benefit, but they needed to get a little bit deeper and try some different strains. So I had a patient yesterday, for example, who we switched her strain of flower. And the same percentage of CBD and THC in this flower to the one she was using before, but she's actually getting a longer acting effect from the new one, and it's better for her pain, even though it's both marked as indicas. It's the same percentage of THC and CBD, and this is fascinating. This is what I mean by I'm still 10 years on learning from my patients, because I said, wait a second, you take the same amount, you take the same inhalation, we're doing everything the same in your vaporizer, and you're getting a longer relief from this new flower. I mean, it's fascinating to me. So the good news in the UK is the product choice is increasing all the time. There's been gaps. I think I mentioned earlier, for my own hand injury, I used to use topical cannabis with THC, not the hemp stuff. And topical THC is not supposed to penetrate the skin very well, but for me, it worked fabulously, and I had a lot of patients in Canada who it worked for. We don't have that. We don't have suppositories. I've used rectal, I've used vaginal routes in Canada. We don't have that yet. We don't have the quick-acting strips under the tongue from the full-spectrum products that I was using again in Canada. So there's gaps, but it is improving. And then I also have patients who are in a very corporate environment, and they cannot take flower into work, and they don't want to smell like flower because it's a very stigmatized environment for them. And while we're all working, everyone in this room, we're preaching to the converted, we're all trying to break the stigma. People still have to go into work that could be quite, it can be quite challenging for them. So that's where some of the vape pens can be useful. But a lot of the vape pens are only isolates. So we're getting more of the kind of the full spectrum products in, but we just don't have the choice. We just don't have the choice that we have in North America here yet. So that is the biggest challenge when I have a patient sitting in front of me, and we've tried 3 flowers, and now we're trying a 4th one, and if that one doesn't work, we don't have really another one to go to after that. So I mean, this is why I find integrative medicine strategy so helpful, because then we look at their gut and we look at their mind-body practice, and there's other things that I'm doing. Cannabis is not my only tool. I think that's really important to say. But that is really frustrating for me, because I know what strain would be great for this person. Even though even the same strain grown in different conditions can be different, but that's a whole other argument. But I can't get a hold of it. And that's where it can be quite frustrating. And that's when sometimes patients go back to the black market, because they know that someone could grow that for them. And that's a really tricky situation to be in as a practitioner, because of course we cannot condone illegal cannabis use, because we can get put in jail for that, our license taken away. But for the patient, they're trying to make the decision that's best for them. So it's very tricky sometimes.
Time moves so quickly. Is there like some weird kind of different time parallel universe up here? It's very strange. So quickly, poor Katya has been sitting there like, what about me? So Katya, before we go on to questions, you've been involved at Volteface with an interesting study. So can you just tell us a little bit about that, and what have been the findings in about 5 minutes tops?
I'll do a quick whistle-stop tour. So for the last year or so, I've been working on a report looking at clinicians' perspectives, opinions, thoughts, barriers, challenges around feeling comfortable in prescribing cannabis. So I've interviewed dozens of specialist clinicians in the UK. The vast majority of them don't prescribe cannabis, which was kind of the point of the report, to understand why we're only tapping into like 0.5% of clinicians at the moment. The reason why we wrote the report was really to focus in on medical cannabis being a medical and clinical issue rather than a political one, because the way in which we saw cannabis legalized 4 years ago, an incredible effort from patients and advocacy organizations. Volteface was involved in that campaigning, but I think off the back of that, we saw that clinicians were not left behind, but clinicians kind of weren't involved in the conversation, and it was legalized, and all of a sudden you have all these clinicians that don't really know enough about the plant. There's still a significant amount of stigma and a knowledge gap. So I sought out to understand what the barriers facing clinicians are, and conducted a number of interviews, and off the back of that, qualitatively analyzed the data, and kind of 3 key themes really emerged from that. And I think these 3 key themes need to be the kind of focus of the industry in many ways around bringing clinicians more into the conversation. The themes probably won't surprise many people. They were evidence, governance, and the kind of uniqueness around cannabis. So when it comes to evidence, a lot of doctors felt that there wasn't enough evidence or research out there to support them prescribing cannabis in the first place. And I think this is a difficult one to tease out because there's loads of evidence out there and evidence is being conducted. I think a lot of clinicians that are kind of cannabis naive and not exposed just don't know it's out there and that it exists. So I think it comes down to communicating this evidence to clinicians more and getting it more into the kind of mainstream medical framework, but also recognition that there's still a lot of work to be done to really support prescribing more widely. The second one around governance procedures, I think this has already been mentioned quite a lot today. Doctors not really feeling comfortable and supported in being able to prescribe. So I think bringing cannabis more into the mainstream and normalizing it's really going to help with that. And yeah, just taking it out of the periphery, because at the moment I think cannabis in many ways sits in its own little bubble and isn't brought into kind of mainstream healthcare. So I think making doctors feel like they can prescribe cannabis and there won't be legal ramifications around that. And the last one, the uniqueness of cannabis. I think as we've all kind of discussed today, cannabis doesn't sit in the mainstream and in kind of normal medicine practices, and I think that scares a lot of doctors. A lot of doctors just don't really know what to do with that information, how it works. As we've said, cannabis is really, really complicated. It's not like any old white pill. It's not a single active compound. And so I think from the interviews I conducted, doctors were open to cannabis and wanting to learn more. But I think that uniqueness aspect of cannabis makes it quite challenging, and they feel like they need to be kind of better supported and educated in that to then feed into the other aspects.
I mean, it's been a long time that they've been told that it's a drug of abuse with no therapeutic benefits. So I think to expect a kind of full circle, let's just go and prescribe it, is a lot to ask, and it's going to be a journey. It's going to be a long road, but yeah. I hope and feel that we're at the beginning or progressing. Okay, so questions. Stick your hand up if you want to ask a question.
Dani, I have your book, CBD Bible. It's amazing. Anybody should buy it. It's wonderful. My question is, why are you not working with the Common Law Court and the International Criminal Law Court of Justice and the Court of Human Rights? Because every single living man and woman has an inalienable human right to be able to use cannabis as medicine. And under common law, you can actually get a license to be able to grow for medical purposes. And you will not get put in prison for it. You might get hassled by the police, but you do have an inalienable human right to be able to use it. So my question is, why aren't you all working with the common law court? Because this is unlawful legislation that was brought in by lobbyists for pharmaceutical companies. Most people are aware, well, maybe not most people, maybe it's just me that's aware of it, but that is something that happened. And a lot of the misinformation was bought through the pharmaceutical companies. So that is my question.
That's a big question. So, I can only speak for myself personally and for the Medical Cannabis Clinicians Society, where I'm the vice chair. So, for our part, of course, I'm a doctor. So, for me, it's about advocacy, education, when I'm wearing those hats, when I'm not with my patients one-on-one. And whenever I have the opportunity, of course, I always want to engage in those conversations. Right now, I cannot write a grow-on prescription in this country, but I did in Canada, even though it was considered very aberrant, even as a prescribing medical cannabis, specialist in Canada. So I agree. I mean, I'm a harm reductionist. I'm very pro having these rights. And one of the things that really strikes me is, even when Clark was speaking earlier about going from being a recreational user to a medical user, what is a recreational user? Most adults that I have ever met who use recreational cannabis are using it for what I would call a well-being purpose. Very few people just want to get really stoned past the age of 25. I mean, there are those people, and you know what? That's the right as well. But most people are using this for a well-being purpose, and I think that's what we have to understand and really acknowledge. Does anyone else want to tackle that one?
I'm not sure if I'm best placed to answer that question.
I mean, I guess I think we should go to another question. I hope that's answered it. Okay.
She mentioned obviously about pharmaceutical companies, but one thing that I haven't heard anyone mention yet is about the spirituality. Obviously, no, I'm not talking religiousness or sitting there meditating or anything like that, which obviously is good for a lot of people. I'm simply talking about the integration of it just in normal life culture, right? I think this would be best for you, Dani, as an integrative doctor. We need to try and get away from doctors being the only ones that can control our cannabis use. We should be allowed to just control that ourselves. It's the only medicine in the world that has side benefits rather than side effects. I'd like you to think about that. So if someone used it just to get stoned, they may be using it to get stoned, but on the side, that's helping them with their sleep, that's helping them with eating, that's probably helping them with stress, that's probably helping them with all other things we all know. So my question is there going to be any discussions about trying to stop this getting too corporate and too pharmacological and keeping it more within the human or within our own purview?
I think there's two different things. We can talk about adult use and, okay, we'll call it recreational use. And there's really two groups of people that want to use cannabis, and they overlap, of course. There's people who want to use it recreationally, whether it's for a spiritual purpose, a recreational purpose. They just like the way that it makes them feel. And then there's people who have medical conditions who actually want to engage with a doctor with this medicine. So I think we need to cater for both. Like in Canada, we have adult use. In a lot of US states, we have adult use. That's legal. But one of the things I see in Canada still is people go into an adult use store, and they are there for really a medical purpose. And it was just easier to go into a store than to see their doctor, who probably doesn't know anything about cannabis still, despite what you might think in Canada. But they actually would prefer to go and have that conversation with a doctor. So I think there should be room for both, and that's really my answer. Is there's people who want to use cannabis as a medicine, and they want that guidance, just like, when I prescribe drugs, I'm doing it with my patient in a partnership, but I'm not just saying, oh, here's a bottle of this medication. Yeah, just go see how you get on with it. And I do the same with botanicals too. I don't just say, oh yeah, just buy this and come back in 6 months and tell me how it worked for you. So I treat them all the same in a medical context. But I don't know if you know Professor Carl Hart from Columbia. He is really the guy that talks about this as well in the larger societal context. Is just because someone uses cannabis doesn't mean that they want to engage with a doctor. They might just use it. They might not have a medical problem. They might just be a cannabis user. But of course, I'm on the medical side, so I'm dealing with patients who want that guidance, want that partnership. Yeah.
Maybe it's a bit easier for us to control that ourselves. I don't know. For me, that's just a personal thing. Maybe.
I totally get where you're coming from. I mean, I am just in awe of the plant and what it can do for me. I mean, I've never been to a cannabis farm, but I imagine if I walked through the door and there was just all these plants, I would fall to my knees and sob because it's just so beautiful. But at the same time, you know, I understand it as a medical, you know, the medical function that it serves as well. But I mean, at the end of the day, even medical, we're talking about health and well-being, you know, and spirituality is well-being. So, yeah, I mean, it's the same as anything. I think you can take it just on a level, and, you know, it is a medicine, it will help you. Or sometimes you just get caught up in the whole, you know, oh my God, this is amazing sort of thing. So.
Thank you. Sorry, I appreciate this isn't an area of expertise for anyone on the panel, but I'd really like to ask about paediatrics in particular and what needs to change within paediatrics to change attitudes there. So my son is currently on an OTC because we can't get a medical cannabis prescription because there just aren't enough prescribers. He's gone from 5 different types, 30 seizures a day, to 2 seizures a week on an OTC. We would love to try a medical grade product, but we can't get it. I'd love to know what you think needs to change in paediatrics particularly. I appreciate it's got a very high bar for evidence.
Yeah, this is a big conversation. So I'm an adult prescriber, but I have actually mentored some pediatric prescribers who are just starting because I treat adults with epilepsy. Now, I am a GP, so in Canada, I treat people across all specialties. Here in my clinic, at Resilience Clinic here in the UK, I have to work in combination with my specialists who work with me at the clinic. But that aside, we really need more prescribers in the pediatric community here desperately. At the Medical Cannabis Clinicians Society, we are working on it. One of the major barriers is the Pediatric Neurology Association. We have written letters. Professor Barnes, who is just sitting over here, I mean, he's been the most vocal advocate, and us as a society have all banded together, and you know, Niraj is part of that as well. So one of the issues is they don't even want really general pediatrics prescribing. They want them to be pediatric neurologists. I mean, the top pediatric prescriber in the world, who I know personally very well, Bonnie Goldstein, who's in California, she was a pediatric emergency doctor. She wasn't an epileptologist, and she has the most experience in the world treating pediatric epilepsy. So I firmly believe that any general pediatrician can do this. So we need to basically remove the fear for these doctors to even get interested in cannabis. And there's a fear, I think, for all specialties, but the pediatric community has made it, neurology community has made it very difficult. So more education, more campaigning. I was on BBC radio this morning with Matt Hughes talking about this issue, and you know, even the questions we were getting back from the interviewer at BBC, it was shocking because he kept on asking me, well, what's the difference between cannabis and CBD, and if these children are prescribed on the NHS, won't everyone just want to use cannabis? And of course, you know, for us in this room, that is a silly question, but actually, that is the question that a lot of doctors are still asking. So we need to make sure we can engage with those levels of conversation too, even though for us it's very frustrating and it's very obvious. So, I mean, it's terrible what you're going through, and the fact that you're having to use OTC products and guess. You know, there's a few pediatric prescribers. We're working to get more through the society. So hopefully, yes.
And just to mention, I think there is a conflict of interest with the Paediatric Neurologists Association and GW Pharma. So, you know, that is an added complication. We're going to move over to Zoom. So I think we have a question.
Yes, we've got a couple of questions, actually. But first, I just thought I should mention the results from... I'm over here if anyone wants to see. We have the results from the prescribers' perspective panels. How knowledgeable do you feel your prescribing clinicians are about cannabis? The majority answered, that's 49%, I worry they do not know enough about medical cannabis. 35% said, I sometimes feel I know more than them, but they are fairly knowledgeable. But I think more surprising is that 16% feel that they are confident in their prescribing GP's level of knowledge. So apologies to the guys online, I'm going to have to group a lot of these questions because there were so many of them. But essentially, the first question really is about what can patients do to help their GPs, to help upskill their GPs, lobby their GP skill, because there's quite a lot of concern I can see in the comments about the knowledge about how much GPs know about the endocannabinoid system, about different strains, etc., etc.
Well, as a GP myself, I can say, number one, they can join the society, the MCCS. Leon Barron, who's in the audience somewhere, he's also started a medical cannabis network for GPs here in the UK, so they can learn more. I think for patients, what they can do is they can just tell their GP. Some GPs might not even be aware that they can refer their patients to a specialist to be assessed for medical cannabis. So know your rights. You can get a prescription for medical cannabis now. And the number one thing I would say is if your GP is not in agreement with you going to see a specialist, you can still go see a specialist. You might, depending on the clinic. So for our clinic, for example, we don't require a GP referral because I'm a GP and I'm also the specialist in cannabis. So I'm seeing all the patients. And even if your GP doesn't agree with medical cannabis, you can still receive this medicine. I think that is one of the biggest messages to send, because I've had a lot of people at patient events and conferences come up to me and say, well, my GP basically shot it down. Well, it's still your right to access this medication. And we just need more education, and we need to understand also that the GPs, the NHS GPs, are under so much pressure. And most of them are really good people, and they're really trying their best, and they go home feeling awful that they just couldn't really help their patients. And it's a really frustrating job being a GP in a system that doesn't really support you or support patients, and that's really what they're dealing with. So, keeping that in mind is being as compassionate as we can while also assessing your rights.
Cool. I think that's unfortunately all the time we have for questions. Huge apologies to the Zoom crowd. We will, again, as I say, try to get your questions answered. We'll keep them up on the system and hopefully get our panelists to come over to the booth and type a few words for you. But I'll throw back to Mary now.
Just to say thank you, everyone. Thank you to the panelists and for all of you for your questions, for your presence. Thank you so much.